When cases of E. coli started breaking out in northern Germany last year, thousands became unwell and more than 50 people died. Initially, officials and politicians blamed imported Spanish cucumbers, but it later transpired that bean sprouts grown locally were the source. In the confusion, Russia banned imports of fresh vegetables from the whole of Europe. So do we need better coordination against pandemics of the future? The European Parliament is currently looking at tightening up European law on cross-border health threats. And two of the MEPs working on it join me now. Liberal Democrat MEP Rebecca Taylor and Swedish MEP Christofer Fjellner. Let me turn to you first, Rebecca, because I know that public health is something of an expertise for you.
Yeah,
so
I studied public health.
You studied it, so just in general terms, how important is this issue?
I think it's very important because, as you mentioned, we had the problem with the E. coli outbreak, and there were different messages going out in different countries, and obviously the vegetables were going everywhere. So what the proposal is looking at doing is just improving the coordination so that the same messages go out in different countries and that people get accurate information. That's one part of it anyway.
I mean, Christofer, what kind of role does Europe already play, and how will it change under these proposals?
I would say Europe doesn't play an important role enough, considering the fact that we travel, disease travel, food travels all across Europe, so therefore I think we have a big role to play. But the main task of Europe up until now has been information. For example, we have the European Centre for Disease Control in Stockholm, that is a European agency to monitor what happens, to let everybody know if we have an outbreak of a pandemic, for example. But I think with this legislation, it will give Europe more teeth to actually see to that all member states sing on the same hymn sheet and spread the same message so we don't get confusion. Because if it's something that is dangerous in a situation of crisis, it is confusion.
And what kind of threats do you think we're talking about here? Well, especially in the future, presumably, you know, it's different every time.
I mean, this particular piece of legislation is actually now expanded to include environmental biological threats, and you can imagine threats arising from climate change, for example. We've seen problems with flooding, which can cause health problems, or spills from factories. These can be cross-border. If something spills into a river along the Danube, it could go into several countries. So that's one way that the proposal has expanded, which is a very good thing.
I mean, you mentioned that it's expanded, the kind of remit, but can you actually legislate for every kind of circumstance?
You can't, but you can make a better framework so that when such cross-border health threats arise, they're better dealt with. You can never foresee everything that's coming.
But I think my perspective on this is twofold. First of all, I think you have to see to that you have a good infrastructure, because you never know what will happen. You never know. The only thing you know is that it won't be like the last crisis. And therefore I think it's good that we have this health security committee and that we try to strengthen that, because that gathers members from all member states to sit around the table in a situation of crisis and exchange information. But then secondly, there are things we actually know will be more happening in the future. For example, antimicrobial resistance is something we know will come in the future. And if it's already here, but we will have more of it.
Because we're getting more resistant to drugs and so forth?
And that drug resistance will spread throughout Europe. And we can already now prepare for how to address those challenges when they occur.
And are we, Rebecca Taylor, doing enough to address
what
Christofer's
hopefully
saying there?
With this proposal we should be, yes. Christofer mentioned antimicrobial resistance. At the moment it is a problem across European countries, but there are different levels of the problem in different countries, and I think with expanding this proposal as is hopefully going to happen, should mean that we get better data on what's happening, and then countries can perhaps share their experiences as well, which is, as I say, through the Health Security Committee. It's experts from all the different countries.
What worries me in this, when we are discussing this specific piece of legislation and this area of trying to address cross-border health threats, is the fact that turf wars somehow risk the effectiveness of a European response. Because we know we have a conflict in Europe between the European level and member states in the area of health.
So in other words, you want better coordination,
I want better coordination, but what what I don't want is what I'm seeing right now from member states' side, that they are just allergic when the European Union starts to speak about health issues, because they say, partly rightly, that health is a national competence. The healthcare system should be administered and should be decided upon by members of national parliaments. But to use that as an argument not to coordinate with others and not to address cross-border health threats, which is a little bit of the attitude I even can find from my own government.
And therefore, is there a risk that these are, we talked about them being proposals at this stage being discussed in the Parliament, that obviously ministers from across Europe in the Council will have to talk about this.
Yeah.
It's a concern
their willingness
that
to
it
go
could
in
get
this,
stuck at that point.
definitely, their willingness to go in this direction and let the European level, the Health Security Committee and this piece of legislation be more forceful. They just don't want to do it, and that's something that makes me a little bit worried. They want to backtrack a lot. But it's at the same time, one have to acknowledge the fact that it is a delicate balance. We should not go in and regulate member states' health systems, but we have to see to that member states sit around the table and coordinate when we need it.
I mean, Rebecca, how confident can you be that if these proposals go through, that they'll make a difference? That, you know, fiascos really, like the E. coli outbreak last year, won't be dealt with in that kind of, or be dealt with in a better way next time?
Yeah, we would definitely hope there would be an improvement on what happened with the E. coli. I mean, as Christofer said, if the Health Security Committee does get strengthened in the way that is currently being proposed, then there will be no reason for that not to happen, because all the people in the different countries will be round the same table. So let's hope.
Right, well, there's still some time to go. These discussions are ongoing in the European Parliament. We'll keep watching them, but for now we'll have to leave it there. Thanks very much, both of you, for joining me.
Thank you.
Thanks.